Introduction. Welcome to today's lecture on the fascinating field of medical nanotechnology, specifically focusing on the application of nanoparticles for enhanced MRI contrast. In this comprehensive script, we will delve into the principles, synthesis, imaging techniques, pharmacokinetics, safety considerations, and future directions of nanotechnology in the field of medical imaging. Additionally, we will explore various case studies, clinical applications, as well as the ethical and societal implications of this emerging technology. So, let's begin our journey into the world of medical nanotechnology and its implications for MRI contrast enhancement. Magnetic resonance imaging, MRI, is a widely used diagnostic modality that provides detailed anatomical and functional information non-invasively. However, conventional MRI suffers from limited contrast and sensitivity. To overcome these limitations, nanoparticles have emerged as a promising tool for enhancing MRI contrast. Nanoparticles, typically ranging from 1 to 100 nanometers in size, offer unique physical and chemical properties compared to bulk materials. These properties enable them to interact with the MRI magnetic field and enhance the signal-to-noise ratio, thereby improving image quality. By selectively accumulating in specific tissues or cells, nanoparticles can also enable targeted imaging. In this section, we will explore the underlying principles that govern nanoparticle-based MRI contrast enhancement and discuss the advantages they offer over conventional contrast agents. To fully comprehend the potential of nanoparticle-based MRI contrast enhancement, it is crucial to understand the fundamental principles of magnetic resonance imaging. MRI relies on the interaction between a strong magnetic field, radio frequency waves, and the behavior of atomic nuclei within the body. When a patient is placed within the MRI machine, the magnetic field aligns the nuclear spins of hydrogen atoms. By applying radio frequency pulses, the nuclei are perturbed, creating a detectable signal upon relaxation. This signal is then processed to generate high-resolution images. Understanding the basic physics behind MRI is essential for appreciating the impact of nanoparticles in enhancing image contrast. In the next section, we will explore the different types of nanoparticles that have been developed for this purpose. A variety of nanoparticles have been developed and utilized for enhancing MRI contrast. These nanoparticles can be broadly categorized into two main types: inorganic and organic. Inorganic nanoparticles, such as superparamagnetic iron oxide nanoparticles, spions, and gadolinium-based nanoparticles, offer excellent magnetic properties due to their unique composition. These particles can be tuned to exhibit desired magnetic behavior and can be easily visualized using MRI. Additionally, they can provide long-lasting and strong contrast enhancement. On the other hand, organic nanoparticles, such as nanoliposomes and dendrimers, offer versatility in terms of surface modifications and tailored drug delivery capabilities. These particles can encapsulate contrast agents and therapeutics, allowing for targeted imaging and therapy in a single platform. In this section, we will explore the synthesis techniques and surface modifications employed to optimize the properties of nanoparticles for enhanced MRI contrast. The synthesis and surface modifications of nanoparticles play a crucial role in tailoring their properties for enhanced MRI contrast. Various techniques and approaches have been developed to control nanoparticle size, shape, composition, and surface characteristics. Nanoparticle synthesis can be achieved through physical methods, such as sol-gel, precipitation, and thermal decomposition, or through chemical methods like co-precipitation and hydrothermal synthesis. The choice of synthesis method greatly influences the final nanoparticle properties, including magnetic behavior and colloidal stability. To optimize their performance and functionality, nanoparticles require surface modifications. Surface coatings, such as polymers, peptides, or antibodies, can be used to confer stability, improve biocompatibility, and enable targeted imaging. In the next section, we will explore how targeted nanoparticles have revolutionized the field of medical imaging by enabling specific tissue and cellular imaging. Thanks to advancements in surface modifications, nanoparticles can be engineered to selectively target specific tissues or cellular receptors. This targeting ability has greatly revolutionized medical imaging by providing enhanced imaging capabilities and improved diagnostic accuracy. Targeted nanoparticles can be designed to recognize and bind to specific receptors or biomarkers present on diseased cells. By attaching targeting ligands to the nanoparticle surface, they can selectively accumulate at sites of interest, enabling highly specific imaging. In this section, we will discuss the various targeting strategies employed in nanoparticle-based MRI contrast agents and explore their applications in disease detection and monitoring. The integration of nanoparticles into existing MRI techniques has opened up new possibilities in image acquisition and analysis. By harnessing the unique properties of nanoparticles, novel imaging methods and strategies have been developed. One such technique is T1 weighted imaging using gadolinium-based nanoparticles. These nanoparticles shorten the T1 relaxation time, leading to increased signal intensity in areas of interest. This results in enhanced contrast between different tissues or regions, aiding in accurate diagnosis. Another technique is T2 weighted imaging utilizing superparamagnetic iron oxide nanoparticles, SPIANs. SPIANs induce magnetic field inhomogeneities, leading to signal voids and decreased signal intensity. Consequently, pathological regions are highlighted, enabling better visualization of abnormalities. In this section, we will explore these and other MRI techniques that exploit the unique properties of nanoparticles for enhanced imaging. Understanding the fate of nanoparticles once introduced into the body is crucial for ensuring their efficacy, safety, and patient-specific dosing. Pharmacokinetic studies allow us to track the absorption, distribution, metabolism, and excretion, ADME, of nanoparticles. By optimizing the size, surface charge, and surface chemistry of nanoparticles, their biodistribution can be tailored to enhance imaging efficiency and reduce off-target effects. Moreover, different routes of administration, such as intravenous, oral, or inhalation, can influence nanoparticle uptake and clearance. Detailed understanding of these factors is vital for the successful translation of nanoparticle-based MRI contrast agents into clinical practice. In the next section, we will explore the safety considerations and potential toxicity associated with the use of nanoparticles in medical imaging. Nanoparticle-based MRI contrast agents offer immense potential for improving diagnostics and patient care. However, their safety and potential toxicity must be thoroughly understood to ensure patient well-being. Key considerations include nanoparticle stability, biocompatibility, biodistribution, and potential long-term effects. Additionally, the risk of adverse reactions, such as allergic responses and immune reactions, must be evaluated. Animal studies and in vitro assays play a vital role in assessing the safety profile of nanoparticles, highlighting any potential toxic effects. Through careful investigation and rigorous regulatory oversight, the clinical translation of nanoparticle-based MRI contrast agents can be approached with confidence. Coming up next, we will discuss the exciting prospects of multimodal imaging with nanoparticles, which leverage the strengths of different imaging techniques. The integration of multiple imaging modalities can provide complementary information and enhance diagnostic accuracy. By combining MRI with other imaging techniques, such as positron emission tomography, PET, single photon emission computed tomography, SPECT, or optical imaging, a multidimensional view of the target tissue can be obtained. Nanoparticles serve as versatile platforms for multimodal imaging due to their ability to encapsulate multiple contrast agents or imaging probes. For instance, an MRI contrast agent can be combined with a fluorescent dye for optical imaging or a radioactive tracer for nuclear imaging. In this section, we will explore the concept of multimodal imaging and discuss how nanoparticles can facilitate its implementation, enabling comprehensive and accurate diagnosis. While nanoparticle-based MRI contrast agents hold tremendous potential, several challenges need to be addressed for their successful clinical translation. One of the central challenges lies in optimizing the performance and stability of nanoparticles, ensuring consistent imaging enhancement across different patient populations and diseases. Additionally, the scalability of nanoparticle synthesis and manufacturing, along with regulatory considerations, is critical for widespread adoption. Furthermore, long-term safety, cost-effectiveness, and reimbursement aspects need to be carefully evaluated. Ethical considerations surrounding privacy, genetic testing, and data security also warrant attention. In this section, we will discuss these challenges and explore potential solutions, paving the way for the future of nanoparticle-enhanced MRI. To truly appreciate the impact of nanoparticle-enhanced MRI contrast agents, we will examine several case studies and explore their clinical applications across various medical specialties. From neurology to oncology, cardiovascular disease to musculoskeletal disorders, nanoparticle-based MRI has demonstrated its potential in facilitating early detection, accurate staging, and targeted therapy delivery. Through a comprehensive analysis of clinical data, we will explore the benefits, limitations, and future directions of nanoparticle-based imaging in these applications. The integration of nanotechnology in medical imaging raises intriguing ethical and societal considerations. Key topics of discussion include issues of privacy, informed consent, equitable access to technology, environmental impact, and potential for misuse. As we unlock the potential of nanoparticle-based MRI, it is crucial to engage in robust ethical discussions to ensure responsible development and deployment of these technologies. In this section, We will delve into these important considerations and explore potential solutions, encouraging a thoughtful and balanced approach to the ethical and societal implications of medical nanotechnology. Congratulations on completing this in-depth exploration of medical nanotechnology and its application in enhanced MRI contrast imaging. We have covered a broad range of topics, including the principles of MRI, the synthesis and surface modifications of nanoparticles, targeted imaging, safety considerations, multimodal imaging, challenges, case studies, and ethical implications. As medical students, you now possess a comprehensive understanding of the potential and challenges that lie ahead in this exciting field. By embracing cutting-edge technologies and maintaining a strong ethical framework, you will contribute to the future advancements in nanoparticle-enhanced MRI and revolutionize the way we diagnose and treat patients. Thank you for your attention, and I wish you all the best in your medical careers.